Good morning, everybody. Welcome to Young Science Leader Series, YSL, presented to you by Young Academy of India, EI. Today with us, Dr. Gitanjali Das. And today is a very special day. Today is a Women in Science, especially this is also called as International, formally it's called as International Day for Women and Girls in Science by the UN. It's a UN Day of International Observance. So I'm really happy to have you with us, Dr. Gitanjali. Dr. Gitanjali Yadav is a clinical scientist working on melanoma, Merck Pharmaceuticals in the US. So she did her MSc in Guwahati University in Assam. Then she did PhD in nanosciences at School of Life Science in the JNU in India. Again, at the forefront of materials and life science. And subsequently, she did postdoc at Johns Hopkins, Rutgers, and Columbia University, three universities, all these Ivy League institutes in the US. And then joined as a clinical scientist at Dubin Breast Cancer Center at Mount Sinai and Pfizer and Leo Pharma. I2 Bioscience at Test Cosmetics. I mean, the work stints are really, fertile. And then she also got an award called Ming Ke Jean Award for the Scientific Excellence in 2016. And she's also, volunteering as a mentor with Freedom Employment Academy. So I'm really happy to have you with us, Dr. Gitanjali Das, and welcome from the family of Young Academy of India and YSL series. And over to you. You may please share your life story with us.
Okay, thank you, Dr. Felice, for giving me this opportunity to speak to the young scientist team in India. And let me share my screen so I can just give you a short pictorial journey of my life. Just a moment. I'm trying to share my desktop. Where did it go? Can you see my screen? Dr. Felix, can you see my screen? Hello.
Sorry, it is still blank. It is it's just blank.
Can you see it now?
No, I cannot. It's still blank.
It's blank.
Mm-hmm.
Is it visible?
No, it is still just a dark background. I can see. That's it. Maybe you can just stop sharing and once again you can try.
Okay.
Yeah, somehow it is showing. I think there is some problem. It is just black. I can see.
Yeah, maybe it's like a Mac problem.
Yeah, Mac problem. Maybe you can export it as a PDF if won't take much time, and then show the
Let
PDF.
me do that.
Yeah,
Yeah.
perfect.
Just 1 minute. Can you see now?
Perfect. Go ahead, please.
You can see?
Yes. Yes,
Okay.
I can see you.
Okay. So hello everyone, and as you can see, I am a clinical scientist at Mark Pharmaceuticals, where we invent medicines to save. Mostly, I am concentrated on cancer subjects, and I feel really fortunate that I'm giving this talk, on this particular day, 11th of February, which is a very important day for both a girl child as well as a woman to progress in science, which is a dedicated day by the United Nations. So let me go ahead and take you back into my journey. So I was born in a place called Guwahati in the northeast of India. And as you can see, we have different cultural as well as natural resources like the one-horned rhinoceros. And we also are a very academically educated people are there. IIT Guwahati is known for producing many, bringing many laurels to the country. So I am born. I have four siblings. That's my brother. He's a doctor in Guwahati, followed by myself, and that's my sister, who is also a doctor in Assam, and my younger brother, who's a marketing professional. That's me with my parents back in US, which is my current home. And I would like to say that when I was a young girl, I always found that my dad used to take me and show me places. Like he used to say, see, this is like Cotton College, which is one of the premier educational institutes in India. And I used to think that I need to come to this place to study. I also remember him talking to me about Columbia University back like when I was a young child. And I just thought, because my dad is saying, maybe this is something of very high importance and I need to go there too. And I'm really my mom has always believed in my crazy ideas and dreams, and because of both of them I have come to achieve my career and my dream. So let me go forward. I'd also like to share that the beginning of a child is at the school, and when we have great teachers who take care in helping develop our child, that goes a long step in the development of society at large. So of particular mention, I'd like to make of my teacher, Mrs. Begum, the class 10 teacher of mine, and I still remember her words, and I still follow those. She used to say to me, Gitanjali, if you want to reach for the stars, reach for the moon, you at least have to aim for the stars. So that's less accessible. That is like something you need to achieve, aim for higher than the level you want to be. And I'm really thankful for her that I imbibe all her qualities. And like I also want to bring to like everyone's attention that books has always been my best friends. When I was at school, I was not a very social person. I didn't have much friends. I always used to immerse myself in books. And my mom used to be at my back that you should read more of your, class books rather than the story books. But I always somehow, even during exams, I needed to go and read a storybook. And this is a particular book by called The Little Princess, and it has been given to me, my friend. And this book is very inspiring because here we see how a little princess living a life of luxury, and when she was forced to go into poverty because of life's unpredictability, how she lived the life of life of poverty with dignity and having a resilient attitude. She could cross those years to ultimately become a true princess. So this book has been my guiding lights since I was a young girl, and I always find that every time you read the same book at different stage of life, they give you a different meaning. And I always converse with my book, meaning in the sense that the story always tries to tell you something important in your life at the current stage. So I think it's and I believe it's very important for people to read like real life stories of other people who have achieved, great achievements in their lives to also develop oneself. And everyone, please do read this book. It's going to help all of you. So and then I went in to fulfill my first dream of studying in Cotton College, which is a premier education institute in Guwahati, Assam. I did my bachelor's of science from geology department, and I would like to make a particular mention to my teachers, Professor Karobi Goswami and Professor Atul Rajkua. They were persons to whom I could always go to, like with my doubts, with either it be regarding studies or regarding other personal issues. And I never felt that they would take some offense, or maybe like they would scold me that why you didn't understand. It's very important for teachers to be always approachable and always try to encourage those students, so that society at the large is benefited by those students. So thank you, dear teachers, for always helping me progress in life. I am very happy that I still share communication with these teachers, and they still help me out in solving like different like life's problems. So then I went in to do masters in cell and molecular biology from Guwahati University. And by the time I was in my 12th standard, I already knew that I want to do research, because that's something which interests me. And though my dad, he was like sad because he wanted me to go and do medicine, but it was not something which was in my stride. I didn't want to do medicine as such, but I really wanted to help the development of medicine by trying to understand the biology of the systems, and understand how disease affects different system and what is the normal biology. So and then once I got the MS and got admitted into Guwahati University, I got associated with Professor Jogen Chandra Kalita, who then advised me into how I can go about achieving my research dreams. So under his guidance, I applied at various institutes in India. And fortunately, I got admitted to the School of Life Sciences at Jawaharlal Nehru University, where I spent 6 years of my life, and it has become a second family to me. So my research at the graduate level was basically to understand how our sleep maintains our body functions, and when sleep gets disrupted, we see the incidence of various diseases like Alzheimer's, Parkinson's, and even cancer subjects also have loss of this particular rapid eye movement sleep. And we can discuss more about that if someone wants to know later. So during those years, I have made great friends for life. And these are the group of people I always go to whenever I have any doubts. Thank you everyone from JNU. And this is just a small collection of those memories I spent in Dr. Malik's lab. Like every Saraswati Puja, we had to go and we went with enthusiasm to Sir's house to decorate the murti and also make rangolis. And this was in our lab, the table around which we gathered to celebrate any memorable occasions of the lab. And so I had like few achievements in the tenure of my graduate years in JNU. And then I moved on, and I'm very happy that I could get admitted for a research fellowship under Dr. Devashish Sinha in Johns Hopkins University. So that was my next dream come true. And it's been a very humbling experience to work in his lab and also associated with Professor Samuel Ziegler. So Sam is a former National Institute of Health I section chief, and it's very humbling to see, how all these great people They have achieved so much, yet they are so free and they are so much approachable in discussing issues. So I'm really thankful for all of them. And as usual, my parents were there to support me in my career. And my research there was focused on basically the RPE cells, which is a layer of cells behind the retina, and whose function is very important in phagocytosis of the shaded rod and the cone shells for proper vision of our system. And after that, I went on to do another postdoc in the lab of Professor Rangping Zhao. He's an amazing person, a very friendly, approachable person. He gives you free rein to try to think about problems and work on your own problems. And so these has been my time at his lab has been very memorable, and is also holds very dear to me. So I would like to bring to everyone's notice very briefly that there was this F receptors present in his lab from before, and nobody has tried to see, how the brain mapping was there in those receptor knockout mice. And I found that when I did Gaussian staining, we found that the neurons get clustered and the fate mapping is disturbed. So currently the studies are going on trying to understand whether this disturbed cell fate mapping results in any behavioral disorders. For this particular publication, I had been awarded the Ming Award from the Biomed Central group of scientific community. And as usual, we always try to enjoy. This is a particular picture of a Rutgers Day, where that particular day, we like people from different all across the world, we bring in different cuisines and different cultural festivities. So that's just a pictorial memory during that time. I also accomplished to get like few publications and award. And after that, it was so when I started I joined Columbia University under Professor James Goldman. And right since the year of 2002, when I joined my graduate studies in JNU, I did a neuroscience PhD, and this book, The Principles of Neuroscience, is a Bible for any neuroscience students. And it was and Dr. and Jim has been the major contributor for the glial biology in this book. And so when I got to work under him, it was a very enriching experience. So at his lab, I had worked to try to understand the phenomena of multiple sclerosis, which is a disease of the central nervous system, and where patients undergo gradual degeneration of the muscles, as well as speech and other problems, other symptoms, and ultimately death of the patient occurs. So in my studies, I found that this particular tractospanin, the CD82, while not has a very important role in the process of maturation of glia, and currently work is underway to try to use this molecule as a therapeutic for multiple sclerosis. So I would also like to mention here that when I joined Jim, I also wedding bells rang, I got married, and we welcomed our daughter, who is currently like 6 years, more than 6 years now. And then a few years down the line, we had a son who is going to be 4 soon. So after my second was born, I decided to take a break, and also mostly the lab funding from Jim has been over, and I was home. I tried to raise up my kids, but like during that time, I also tried to find out how I can help other people, and give back to society. So I then joined this NGO called the Freedom Employment Academy. It's an NGO set up by the world-renowned author Deepak Chopra, and it's fascinating to know that he's also an MD turned author. And in this during this mentorship, which I also currently do, I go on Zoom calls every bi-monthly, and it goes on for a batch of 20 to 20 to 25 students, and it goes on for like 4 months. So every 4 months I have a new set of students, and in this mentorship program I have found that, while we discuss issues like social issues or any technical issues, like most of those people, they have helped me in a getting some form of um, more positive aspect into my life. It's always, mentoring is a two-way path. I have also found that during my mentoring that mostly girls and also like moms have confidence problems, and so I try to help them overcome those confidence problems which is related to the societal issues. And I hope and that this issue is going to be resolved soon. So during this self-imposed, break, I also freelance with few other companies like Pfizer, the I2 Biosciences, and Leo Pharma, where I worked on pain inhibition, the testosterone therapy, and also cirrhosis, which is a skin condition. And then there was this interesting work I did with a startup called Test Cosmetics, where I was involved in making a certain product line available in the market. So I was also involved in reviewing different manuscripts, and because of that, like I got invitation to become an academic editor for PLOS One. So this break has also been very fruitful. I was enjoying my time with my family, and I was also doing freelance work. So after that, after a gap of almost 2.5 years, I decided to come back to work. And then I got the opportunity to work at the Dubin Best Center in New York City under the team of the world famous surgeons like Dr. Eliza Port and Dr. Hank Smith, and where I had been involved in clinically running the sponsored trials from like Champions Oncology, AstraZeneca, Pfizer's, and others, as you can see here. I was also involved in talking with this team of people, physicians, and trying to generate different protocols, and by looking at the subject data and see how we can bring up more protocols and go about in collaborating with different pharmaceutical industries to try to help the breast cancer subjects. So the fight still goes on to curb the incidence of breast cancer, which is another sort of pandemic that's going on. And then in the beginning of 2020, the COVID pandemic started. And so I, as a mom, as a scientist, had to step back and think and strategize with my family how to work about. I was previously commuting almost 3 hours a day from New Jersey to my job in Mount Sinai on public transport, and then which was not feasible anymore. So I was trying to find out how I can also have a career and also look after my family. And then with the help of my family, my husband, I tried to look up for jobs where I can work from home. And fortunately, I got a job as a clinical scientist at Merck Pharmaceuticals, and I am a proud Merckian. And everybody at Merck echoes with this philosophy of our founder, George Merck, where he had said that we need to design medicine for those patients and not for the profit. He always used to say that profits will follow, but we have to take care of our subjects first. So, and this I am involved with running 2 clinical trials, phase 3 clinical trials in melanoma, where basically it's about the Keytruda drug, which is an immunologically drug. So this Keytruda goes and binds into the PD-1 receptor of T cells, and If that Keytruda and the PD-1 binds, then the ligand of that is present in the tumor cells, they cannot form the lock and key combination, and so the T cells can initiate the process of T cell mediated cell death of the tumor cells. And this is basic representation of how a mole of our skin can progress into a cancerous form. If someone wants to discuss more, I can go into details. And I also wanted to share that I got an award, like 2 awards from within this 9 months of working here. And it's a fruitful journey. I still look forward to contributing towards the growth of the cancer drug and helping subjects. And I would like to bring to everyone's notice here that because today is a day for women and girl child in the STEM, we see that like this is a recent publication from the Lancet of 2019, where they have done a all over the world survey, and as you can see in India, the women in the STEM force is very less, and it's going on decreasing day by day. We need to understand what is the problem that's facing the girl child. And from what I could feel from my mentoring sessions with the FEE, it's mostly, they have confidence issues. Sometimes when I was talking to those people, few of them came back that I used to tell them, you need to ignore people who try to bring you down. But then they used to come back that what do we do if it's someone within our family? Like, how can we ignore them? So it's something that we need to, as a society, need to think about and strategize how we can bring up the female population at par with the male population in the STEM field. This is another recent study published in Journal of Neuroscience, and this is a data from the United States. So United States of America, we know it's a very developed country, but still we see this gender disparity when we go to higher education. So as per this survey done by the paper in Journal of Neuroscience, even though the girl child is very high in achievement, still the school level, the percentage that goes on to get admitted into, say, engineering or medicine is far less in compared to their male counterparts. So this has got me thinking like how we can try to remove this disparity, right? And like in the times of COVID, it has become more and more pressing, because we see like even when I talk with people, like I know like few friends who had to take the back seat during the times of COVID to try to take in responsibilities of the family and leave their job. It's very sad. Everyone has different circumstance, but we as a whole, we can try to overcome this limitations. So I believe a girl child needs to let go of this attitude that I can't do this. She needs to believe in herself, and she needs to say to her every day that I can and I will do it. That's how the disparity is going to end. And it's very important to have strong family structure, like even like a brother and a father and cousins. It's very important that those people, the male counterpart in the family, understands the issues that their female counterpart is facing in amidst the family itself and also in the larger society, and try to support them. And society also has a very, very important aspect in making, in helping to get rid of this disparity. There are various issues like gender bias, and violence against women, which needs to be taken into consideration. Moreover, we as women, we also need to support each other which is the most important part of helping to get rid of this disparity. And I'm sure all of you would have more valuable suggestions about how we can get rid of this disparity, because when a woman comes into par with the male counterpart, there is progress of the family at the core and family of the society, and which also increases the economy of the country. So we need to go into more strategic details about how this can be done. So I thank all of you for listening so patiently to me. I thank Dr. Felix for inviting me to talk on this very important day, February 11. And I thank God, my friend and family for helping me continue on in this journey of mine. Thank you so much.
Yeah, thanks a lot, Gitanjali. It was fantastic, and I really enjoyed your life's journey, and it's absolutely inspiring. Unfortunately, there is a technical glitch. The slides were not moving, but it doesn't matter. You
Oh,
explained
I'm so
very
sorry.
nicely. It doesn't matter. So it was really nice, and all we could see is the background. You see the Zoom background, no problem at all. But you actually explained everything in very nicely. I can actually picture your own childhood, your time in Guwahati, and when you were saying about the lab experiences in Jawaharlal Nehru University, I mean, I can picture it. That is what you explained so nicely, so beautifully. And I'm also really happy to see that you're volunteering your free time with the Freedom Academy. And I hope you will consider our Young Academy of India too. We also have the mentorship program, and the call for the new mentor-mentee exchange, idea exchange, or rather a match-making program is expected to be announced within 2 weeks' time. And we named it as MEntX. Earlier it is called VISL, Virtual Internship with Science Leader. Now it is called Mentex. So yeah, I also got an invite from the TEDx to talk about this idea exchange program. So I'm looking forward to do that way. So can you just give some tips on the budding PhDs? The recent PhDs, how to get a job in industries. You have got a fantastic job with Merck. So what are the things that they should care about during their PhD, or even should they start preparation during their masters to land in an industry sector like a reputed Merck corporation? So what are the tips and strategies that you can share with our young scientists of the country?
Yeah. Congratulations on that initiative. So I really look forward to be part of that initiative. And for like PhDs or science students, I would like to say they need to network with industry people to try to understand what is, and also like read all those industry news that comes out, like Fierce Biotech and other industry related articles, and try to be at abreast of the current trends, and try to go on discussions with the leading people in LinkedIn. You can call contact those people and try to understand how a particular company operates. And mostly it's pharmaceutical companies, they want people who are like passionate, who are to do the drug development. So it's basically like someone at the master's level can also get into industry, but if you are a PhD, you get entry into a higher level as a scientist. But entry at the master's level also, you can get promoted and become a scientist, like say like spend like 5-6 years in the industry. So it depends on an individual, like whether they want to have that academic experience of a PhD or as a industry experiment. I would say when I did my PhD in India, I learned many things. I also learned how we need to get things done with the limited resources. So that teaches you, like how you need to interact with industry professionals, because in industry you always need to be very efficient in your time and your delivery. And so these are things they always look out for. It's very important to network, and I believe that's the most important thing. Yeah.
So the prospective candidate should really pay attention to their LinkedIn profile. Do you agree? Yes.
Yes. It's very important, because like people always go on LinkedIn and try to call contact, and then by call contact I mean you send in a request to somebody whom you don't know. So that's called call contact. But yeah, LinkedIn connections, Twitter, you go to the Twitter pages and try to understand what the company is doing. So that way you will form a relationship, and then At the time you want to go into the job market, you already have your relationship, so you have to work out through your internal referrals to get your job, your CV to the hiring manager, because if you just apply to the portal, most of the time the machine just rejects you. So if you know someone, it will help you. Yeah.
Yeah, very interesting. And I never heard this term before. I'm just writing down cold contact. Very nice for that. Now, the publications. Does it matter? So the publications are really, really important for the academia as well as for the scientific jobs. And it's the mindset is publish or perish. So for the industries, does the publications matter or not? What is your take on it?
So, if you have to become a basic scientist in industry, publications in companies like Genentech matters. It doesn't matter as much as in pharmaceuticals like Merck, Johnson and Johnson. But there are certain companies which are more academically oriented. Like I know for certain Genentech, they give priority to your publications. But but like a position like what I am in as a clinical scientist, it doesn't matter. You just need to have experience as working and running clinical trials. So, yeah.
Fantastic. Now, the COVID-19 situation is striking super hard for all of us, the trying times. So, I was just looking at your Zoom profile. I mean, Zoom, the profile name is STEM Mom. And can you just explain how the women in particular is being affected, especially the gender balance in the job? Especially, I came to know that many female fraternity are quitting their job to stay at home, to homeschool their children. So is the same trend is happening in the US as well because of this COVID-19 situation?
Yeah, because like many people who are working as a basic scientist in the universities, their funds are not there and people cannot go in to do the experiments. So I know a few of friends who have had to leave their jobs, and it depends on a balance, like who is going to take care. And it's most in some families it's mostly the mom, and if you don't have a supporting spouse, then it becomes very difficult to make the transition. I mean, for myself, I made the transition when COVID happened to pharmaceutical, so I am really thankful for my husband that he supported, he shared responsibilities with my kids, with our kids. So it depends, like you need to have a good family structure and like understanding between the amongst the family members. So that's very important to help bridge this gap, like the less female ratio in like upper corporate, even corporate jobs. If somebody in the family doesn't share the responsibility, like as a mom, I will quit my job. My kids matter the most to me, so it will not take a second. Like, so it's very also very important to not quit your job. I don't think I will quit. I will try to find out some resource, how I can have my job and also like have the kids taken care of. So yeah.
Yeah, very interesting. And now this is the series is called Young Science Leader Series. And now the science leadership, when it comes to that, women in general in science, the gender equality is now getting almost over. It's almost, you can see male and female in at least maybe 30 to 40%. Of course, it depends on the field. For example, in biology, you can see a lot more female than, of course, maybe as good as, but in physics or chemistry, you will see a lot. It's still a male-dominated world in academia. But now coming to the leadership, so the situation is really pathetic. For example, in India, if you look at the female vice chancellors of the university, it could be less than 2%. That is really, really a strange scenario. Do you have any? I mean, the situation is almost same elsewhere too, but we really need to change that situation. And as we have seen that in COVID-19 period, the women in the top of the in the government policy makers, for example, in Germany or the New Zealand, media is celebrating the way that they implemented their strategies. What is your take on this issue? How to bring more women in the leadership role in science?
Yeah, that's really like thought-provoking question. And it's very important to, to bring women to the top positions. But it will take efforts to start at the basic ground level. You need to have more representations of women at the basic, basic school level. There are not many school principals as women too, and like college principals, like vice chancellors and all, like it's a thing, people and society has to work together, because if you don't support your women in the society, then how will they progress, and how will they take up more responsibilities? It's not possible for one person to take up and become like an iron lady, it's good to know that be an iron lady and all, but it in practical life it's not possible. So we need to, as a family and as a society, we need to support each other. We need to give certain leeways, I think, in terms of not in terms of responsibilities, but in terms of, say, maybe an extended time. Say, instead of having a project delivery of I'm speaking as a vice chancellor, instead of having a goal delivery of, say, like 6 months, you can extend the delivery goal to, say, about 8 months, to just to give her, so that she can come at par to the male counterpart. So I feel that's one way we could do that. And the major thing is there has to be drastic change in the attitude of our society, in the attitude of even many female persons. They don't support the growth and development of the female themselves. So that we also need to change ourselves, I believe. And the family needs to change. So I see it's happening in India, but it's going to take some time. We need to educate people more. We need to educate the boys and the men in the family.
Yeah.
So yeah, I think like with this, it's going to happen sooner.
And it's really interesting to hear about your childhood days in in Guwahati. I've been there only once for the Indian
Oh,
Linguistic Society meeting in IIT Guwahati. It was a fantastic place. Guwahati is a beautiful city by the banks of the Brahmaputra. And you lived in many places around the world. Guwahati, in your schooling and college at the University of Guwahati. Then you moved into the Delhi, JNU, and then Austin, Texas, and now you're in New Jersey, interacting with so many international, human beings. So my question is that how do you, is there any tips for intercultural or cross-cultural communication?
yeah, I think if you listen patiently, you will always find a common link across culture. And different cultures have different way of communicating. Sometimes you might think, that other person is arrogant, or maybe he's not, he or she doesn't want to help. It's not that. It's only the way those people are brought up. So you need to give the other person a little time, and you can ask that, did I do something wrong, or can I do something more for you, to help this situation. And like human beings all over the world, I believe, are helpful. And if you go out with an open mind and an open heart, they will always respond back. So yeah, you have to be patient. That's what I found with people, and it helps out. Did it answer your question?
Absolutely, being patient is really really important. Yeah, that is a take-home message. Yeah, being patient while interacting, because human beings, as such, we share a lot of similarities across the culture. Right? The essence of human being. I like to read the books of the Robert Greene and the laws of humanity and things like that. There are so many binding structures. Of course, being patient while interacting, while listening, right? Be more of a
Yeah,
listener. Those are
listening
very
is the
interesting.
most important thing. You make great friends listening, and yeah. You learn a lot listening, and you progress more listening. So you
Exactly.
imbibe more the knowledge.
Unfortunately, these days the situation is that, I mean, I also attended a few meetings, so the person who speaks in a very loud voice is being heard, while people who don't speak in a loud
Yeah.
voice is not heard. So that situation needs to be changed, you know. So anyway,
Yeah.
fantastic. I really liked interacting with you. And before concluding, if I ask you one final message for the young researchers of the country, we have a large number of subscribers, more than 13,000 and more than 20,000 members of this group. So what would that be? You have one final message for the scientific and young researchers of the country.
My message would be try to follow your passion, try to see which area you want to go to, because your passion, then it would not look like a job. You would enjoy doing that science, and then you will do great science in that field. So that's my only take home message. Follow your passion, know yourself, what you want, where you want to contribute, and that's going to help you as well as society. So yeah, that's my message.
Excellent, Gitanjali. It was really pleasure interacting with you and knowing you as a person, and that also in this very special day of the UN, International Day for Women in Science. So thanks a lot from the family of Young Academy of India. Happy to have you on board, and I hope you will be, you'll extend your services by mentoring a couple of students who are going to apply for the forthcoming Mentex program. Thanks a
Oh
lot,
yeah,
and
sure. Yeah, I look forward to that. I hope I can help and inspire others. And thank you for giving this opportunity to speak on this very important day.
and
Thank you so much.
I also appreciate the time that I think it is almost 11 o'clock in the midnight, isn't it? So it's, yeah, it's here like I'm just getting ready to go for work. It's just 9:15 here now in India. Thanks a lot, and good night, and take care.